Hey everybody, good morning. So today we have a safety training. It is on first aid safety and review. So should be fun. But I'll try to get through it as thoroughly and quickly as possible. So first thing we're gonna go over is what we need. In an emergency for first aid, what do you need? You need a first aid kit. So we're going to, hopefully this doesn't fall. We're going to prepare a first aid kit. In it, well, and this can be for you at home or at program. So in it, we have things to use in our home that we keep us safe, healthy, and happy. Food and water is number one. You need water, you need food. Clothes that keep you warm and dry, a comfortable bed and pillow, a toothbrush and toothpaste, and fun things that entertain like books, music, television. The internet, obviously, as well, is something that a lot of people use. Okay, a first aid kit is another item we need in our home, as I said. A well-stocked first aid kit can help keep you safe and healthy in your own home. You may have some questions like, what items should I put in my first aid kit? How can these items help me when I get hurt or feel sick? How often should I check to make sure that I have all of the things that I'll need? We're going to help you answer these questions. And we will. What is a first aid kit? A first aid kit is a box that holds all of the equipment, medications, and cleansing solutions you will need to give first aid to yourself or someone else. You and other people, including your support person, can use your first aid kit. I would be the support person. Or your ILS worker. Or if you live in a group home, whoever runs the group home. So what is first aid? First aid is the help that you can give someone who has been injured. First aid is for minor injuries, not serious ones. First aid can be done anywhere, especially at home. First aid can be washing and covering a small cut, putting ice on a bruise, or if something's swelling, and taking someone's temperature, which we're going to be doing quite a bit. Who can do first aid? You and other people, including your support person, can do first aid. You'll need to let your support person, friends, and family know where you'll keep your first aid kit. However, some things may need to be done by professionals like paramedics or doctors. If you aren't sure about doing something, the best thing to do is tell someone or call 911. So if it's a serious injury and you're like, or the bleeding won't stop on something, even on yourself, and you're not sure, ask your staff, ask your support person. But if they're not sure, have them call 911, or if it's really bad, you'll know that you need to call 911 immediately. Like if I broke my wrist once, I knew it was broken, and so I had to I went to one of my superiors, and I was like, hey, I'm pretty sure I broke my wrist. I need to go see, because I couldn't move it, and you would know, like, you really can't move it. And again, there's lots of swelling. You should call 911 immediately if someone A is unconscious. This means that the person isn't awake and doesn't need anything. Is severely bleeding. B. C has broken bones. D is in shock. Or E, in these cases and in any other situations which you feel you can't or shouldn't give first aid, called 911. And you do need to have a CPR card, a CPR first aid card, in order to give like serious first aid. So you don't want to hurt the person even worse. So it's best to call 911. Some equipment you will need in your first aid kit are bandages of all sizes, sterile gauze bandages, cotton balls and cotton ball swipe swabs, instant cold packs, a thermometer, disposable latex or synthetic gloves, just in case you're allergic to latex. You can look at this checklist to find out the other equipment you'll need. So there is an email address down at the bottom of this. Yes, you can see that. If you want to pause this and take it down, you can. If not, I'm always here as a reference. Why do you need so much equipment in your first aid kit? That's a good question. Injuries from household accidents can happen at any time, and you want to be well prepared for any situation. Because we can't predict accidents, it's good to keep a variety of equipment in your first aid kit, like bandages for minor cuts and scrapes, instant cold packs for bumps and bruises, and a thermometer to take temperature that are caused by fevers. Alright, here are ointments, medications, and cleansing solutions that you'll need. Ointment, you want hydrocortisone cream for itchy skin, antibiotic ointment like Neosporin, medications, pain medication like Tylenol or Advil. But again, you should always know if someone's allergic to any of these before you administer them. Cleansing solutions and antiseptic solution, like peroxide to clean and disinfect minor cuts, eye wash or saline. Check out this list for items you'll need. If you live in a licensed residential facility, you will need a prescription from your doctor. So here's another website. Again, pause it if you need, and you can take down the information. Alright, moving on. You'll need to find a container to hold all of these items. Choose something that it will last a long time, has a lot of room, and is lightweight, so it's easy to carry, so it's also transportable. That's kind of something you want. Has handles and is easy to open and close. Label this container in large letters with a marker. You can call it My First Aid Kit. You'll also want to buy a first aid manual or print out some instructions from this website. So again, if you want to pause it, there is the website. You can take down that information. Alrighty. Okay, so now that we have our first aid kit, let's visit Caleb, a basketball player. Sometimes Caleb falls down and scrapes his knee. What can you use from your first aid kit to help him feel better? Clean his scrape with soap and warm water. Remove any bits of gravel or dirt if it's an outside basketball court. Gently pat the wound dry. Apply some antibiotic ointment and then cover it with a bandage. Caleb is glad that you have a well-stocked first aid kit because he feels so much better now. Remember, do not let anyone else use medication prescribed by your doctor. So if a doctor prescribes something for you, it's just for you. Later, Caleb and Bella come to your house for dinner. Bella is helping you in the kitchen and accidentally burns her hand on a hot pan. Ouch. First, decide if this is a minor burn. This presentation can help. So there will be another website to check out. With your first aid kit, you can help her hold her hand under cool running water for a few minutes. Do not put ice or grease like butter on the burn. Loosely cover the burn with a sterile gauze bandage. So here's a website. Right. Yeah. And all of this information is very good because Again, you don't want to make things worse. You only want to make things better. With practice, you can help yourself and others with your first aid kit. You can be well prepared for small accidents around the home or nearby, like falling down on the pavement, hitting your thumb with a hammer, burning your hand on the stove. With a well-stocked first aid kit, you can help make yourself and others feel better. Use this checklist to put together your first aid kit. There's another website down now. So if you want, pause it and check it out. Hopefully you already have a first aid kit. Alright. You'll need to check your kit every few months, just like we do in our vans. Replace any items that you've used or are missing. Check expiration dates. That is very important. If it's expired, it's probably past its prime time. So check expiration dates on medicines, ointments, lotions, and other cleansing solutions. Throw away those that are expired, are too old to use, and replace them. Set a schedule for yourself for when you will check your kit. Again, we do ours for our van monthly. And there's also this. You can check out all these links. If you want, I would suggest you pause it. You can write these down. But yeah. So that's first aid kit for yourself in your home. So my first aid kit, first you need a container, bandages of all sizes for different sizes of people, sterile gauze bandages, tape, tweezers, scissors, safety pins, cotton balls and cotton tipped swabs. So like ones that go in your ear. But sometimes when you have a little cut, you can actually take the ointment and use one of those little ones to actually get stuff on there. Instant cold packs, again for swelling or bruising. A thermometer, disposable latex or synthetic gloves, a flashlight with extra batteries. Extra batteries is good. A mouthpiece for giving someone CPR, which we always have in our van. So all these things we have in our van. List of emergency telephone numbers. Again, we have that in the glove box in the van. Hydrocortisone cream, pain medication like Tylenol, acetaminophen or Advil, ibuprofen, antibiotic ointment like Neosporin, calamine lotion. So that's for like a bad sunburn, calamine lotion. Or insect bites. Calamine lotion is really good for that. People use it when they get chicken pox to help the itching stop. Alcohol pads or alcohol and cotton balls, antiseptic solution like hydrogen peroxide, soap and hand sanitizer, which hopefully we have in stock somewhere, eye wash like saline, and any other medication or supplies needed for a specific health condition. Again, if you live in a licensed residential facility, you will need a prescription from your doctor to prescribe anything for yourself or anything like that. So here's a good list of things that you will want. Alright, now we're going to go over first aid review. So what I'm going to do is I'm going to pause the video. I'm going to ask a question. I'm going to pause the video, and I want you to ponder the question. And then I will start the video again. But again, I want you to ponder the question and think of an answer for yourself. So when the situation, if it does arise, you know exactly what you're going to do. So if someone is having a seizure, how can you help that person? I'm going to pause it. And you ponder. Alright, everybody, I hope you've had a chance to think about it. So, if someone is having a seizure, how can you help that person? The best way you can help that person is to make sure that there's nothing around them that they could hit their head on or hurt themselves with. Alert a staff. And another thing is to check the time. I've seen it happen. It's kind of difficult to do because you're so concerned about the person, but checking the time is really good. So if you do have to call paramedics, which you probably should do, you can say this is what time the seizure started, this is what time it ended. But again, make sure that there's help clear the room, clear all the space. The people shouldn't be around. Alert your staff, and then check the time. What should you do if your friend starts choking on her lunch? Alright, I'm going to pause it, so you pause as well, and then we'll be right back. Okay. Hey everybody, so what should you do if a friend starts choking on her lunch? Well, if you have your CPR license, you have learned the Heimlich maneuver. And so you could perform that. If you have not had that training, you don't want to try it yourself, so you should alert your staff immediately. You should say, hey, someone's choking over here. I need your help. And you can be as loud as you want about it. If for some reason the staff is away, like in the restroom or something like that, announce it to anyone around there and say, I need help. This is an emergency. I need help. Because it's better to not hurt the person. It's better to just help them. So that's what you should do. Number 3, if you accidentally spill hot tea on your hand, what should you do? Alright, I'm going to pause the video, give you a chance to ponder, and then we'll get back. Okay, so if you accidentally spill hot tea on your hand, what should you do? Well, we kind of went over it in the last segment. You want to run it under cold water. Depending on how bad the burn is, I mean, if it actually burned off some skin or something like that on your hand, you might need more attention. But if it's just like a slight burn, yeah, you want to run it under cold water. Just help release the heat, because that's what you want to do, is you want to get that heat out of there. You can maybe get a piece of ice and start rubbing it on there, or an ice pack and rub that on there, and that'll help release the heat as well. But that's what you want to do. Okay, if you're on an outing on a hot summer day, what can you do from getting heat exhaustion? Alright, I'm going to pause it, you pause as well, and then we'll reconvene. Alright, welcome back. So actually number 4 and number 5 are kind of, they're similar in nature, so I'm going to read 4 and 5. So if you're on an outing on a hot summer day, like working at the park, what can you do from getting heat exhaustion? And then number 5 is, what are some good ways to protect yourself from the sun, especially on a hot summer day? Well, main thing is you want to stay hydrated. Drink lots of water. Water is good. Water helps. It keeps, I mean, once you're hydrated, your body can it functions a lot better. Also, make sure that you take breaks, frequent breaks. Especially if you're working in the park, things like that. Or ask to sit in the van and talk to your staff and say, I need some air conditioning, or I need something like that, because I need to cool down. And staff can help. You can always wet down a shirt or something like that, put it around the back of your neck, and really cool yourself down. On really hot days, you want to make sure you're wearing sunscreen, a hat, and don't wear too many clothes. I see it far too often where people are out in the sun on a hot day and they have way too many pairs of clothes on. You want to make sure that you're dressed appropriately for the occasion. Because if you overheat, it's because you worn too much and the sun is beating down on you, and you're just going to get hotter and hotter and hotter. So you want to keep that internal temperature down as much as you possibly can. So again, hydration, sunscreen, wearing appropriate clothing, taking breaks. These are things you can do. Sitting in the shade if you get too hot. And make sure, if you really are overheated, that you talk to your staff and say, I need a break. and I might need to go sit over in the van. Can you start up the van? Staff will accommodate. We'll make sure you're okay. Okay, number 6. If it feels you have something in your eye, what should you do? Alright, I'm going to pause, you pause, and then we'll start over again. Alright, so if it feels as though you have something in your eye, what should you do? Again, I would say with all of these, you should always let your staff know, but immediately what you want to do is you want to flush out your eye. You can flush it out with water, kind of splashing it into your eye. It might not feel the most comfortable, but it'll help flush out whatever is in your eye. Because you don't want to scratch anything that's in there. I mean, vision is a good thing to have. You can hold your eye open like this for a while. Sorry, that looks creepy. But if you hold it open, what'll happen is it'll start to kind of condensate itself, and then it'll flush itself. But I would use water. That's what I would do. But let your staff know. Say, because, I mean, when we're at the park and things like that, a lot of the time, we have debris kind of floating around in the breeze, and things can land in your eye. So make sure, there's bathrooms and things like that, but flush out your eye. Let your staff know. If it's worse, staff will take care of it. That's our job. Okay, if you start feeling dizzy and lightheaded, what should you do immediately? So I'll pause, you pause, think about it, and then we'll get back. So again, number 7, if you start feeling dizzy and lightheaded, what should you do immediately? Well, you should sit down or lie down immediately. And then you should alert your staff. But first you need to sit, because sitting or lying down is better than falling down, because you could really hurt yourself even more if you fell. So don't go running to find something or do anything like that. You just want to immediately sit down or lie down and make yourself comfortable. And hopefully you're near a shaded area, and lie down in a shaded area. The cooler your body is, the easier it is to recover from it. Alright. So next one, if you accidentally cut your finger while using some scissors, what should you do? Alright, I'm going to pause, and then we'll be back. Alright, so if you accidentally cut your finger while using some scissors, what should you do? Well, if it's bleeding, you need to stop the bleeding. So stop the bleeding. Again, alert staff. Let them know. I cut myself. And then staff can actually help you with it. And then you'll want to clean that and put gauze bandage on it and wrap that up. If it's a minor cut, you still want to clean it, put a band-aid on it, and make sure that it's not bleeding too much. But if it's bleeding a lot, then you want to have something a little, more structurally sound, something that's really going to hold it in. And last question, why is it important to keep an open wound or sore cleaned and covered? Alright, well, we kind of just answered that, but I'll let you think about it and see if you come up with some different answers. Alright, I'm going to pause, you pause, and then we'll come back again. Alright, so why is it important to keep an open wound or sore cleaned and covered? Well, the main reason is what we don't want if you hurt yourself. You don't want to get an infection. You don't want bacteria and things like that getting into your wound. That would be bad. So the more you clean it, the less bacteria actually gets in there. And then once you put ointment on it to help heal it, the faster it's going to heal. So you want to make sure that the wound is not exposed to just the air and everything around, because there's bacteria in many, many things. So you want to make sure that you keep everything clean and keep a wound closed. But that's it for our safety class. If you have any questions, always feel free to ask me. And I hope you have a great rest of your day. I miss y'all, and I hope to talk to you soon. Alright, bye everybody.